Okay, I think we have everybody. Thank you again for joining in today's presentation on care coordination and communication with PACE. My name's Christy. I'm one of the GCAP trainers with San Diego PACE. During the presentation, my camera will be off while I'm presenting the slides. However, the chat is open. So certain points during the presentation will be able to participate, or if you have any questions, go ahead and put them in the chat. Let's get started. Thank you. Okay, so again, today's presentation is on care coordination and communication. Our agenda for this presentation, we want to describe what care coordination is. We want to know the importance of care coordination communication, how the PACE IDT team is structured, understand how we can coordinate care, and then we're going to go over some scenarios of care coordination and communication, and that will be where we participate. So first, I want us to think of how our participants feel, either as they're joining onto PACE or switching providers. A lot of patients or participants have similar questions, such as how can they get their medications? How can they get their diabetic supplies? Interestingly enough, a lot of patients will switch right as they're about to run out of medication or be running low on their medication. How they can find a dentist, how they can get to their appointments, how they can schedule appointments, how they might find a counselor, how they might start their physical therapy or occupational therapy, how they might find a specialist. And particularly, this happens a lot with patients as they switch providers or they change insurances. Now they have to start all over with a new specialist and they're really not sure how to go about the process. Or a lot of them think they can continue with their current specialist only to find out that they can't and they need new specialists. Also, they think about how they can locate housing or food resources in their area. And we even have those that wonder how they can now do their laundry. Maybe they had a caregiver contracted with their previous insurance, and now they need a new caregiving service, so they want to make sure that they're able to get their laundry done. Care coordination is the organization of your treatment across several healthcare providers. This was according to healthcare.gov. And the importance of care coordination communication. When healthcare providers do come together and we communicate information to the right people at the right time, then we're able to provide effective care aligned with patient goals. Now, if a patient is requesting information regarding their cardiology diagnosis or even a hepatology diagnosis, and yet they're communicating this information to, say, somebody in the physical therapy department, this information wouldn't be to the right person. So they're really unable to provide effective care. The most that physical therapists can do, or the reason why we need to understand the importance of the communication within the care team is because we want to make sure that that message gets to the right person so that we can take care of that patient's goals. What this means, let me exit out of here. For some reason, this slide doesn't work. Um, So with PACE, what this means is we personalize all of our participants or patients. They have their own personalized approach to healthcare while assessing individual conditions, histories, and their goals. And this leads to improved outcomes and also increased efficiency. Within PACE, we have the PACE ID team team or interdisciplinary team, and there's meetings conducted at various points throughout the week or as needed depending on our participants. And this is where a lot of the service requests get addressed, including, for instance, when it comes to the caregivers. This would be where, increased caregiver hours are, or a change in a caregiver service, anything like that would be discussed. And the way those are structured, we basically have the mandatory IDT members, which include an IDT manager. And each IDT manager has a primary care physician, registered nurse, a social worker, physical therapist, and occupational therapist, the activity coordinator, registered dietitian, home health coordinator, personal care aide, and transportation representative. So in these meetings or when decisions are made, basically there's one person assigned within each IDT team that they need to come together to constructively have any input they need to make a decision about a participant. Now, the other participants that are in this team meeting, we consider the support staff, which would be the clinical coordinator within PACE as a medical assistant, their case manager, a referral specialist, behavioral health counselor, and behavioral health SUDS counselor. The reason why this support staff is also important in making these IDT decisions is because there's some information that the clinical coordinator might learn about a participant while rooming them or on the phone with them. A lot of times family members feel comfortable discussing certain things that they might not bring up when they're having their actual assessment with their primary care physician or the nurse. So they also have a lot of input that can go into making these decisions, as well as the referral specialist. So in these IDT meetings, if we're discussing about a participant that had an urgent referral place and we're wondering the status of that or why it's taking so long for them to get into this specialist, the referral specialist would then obviously have the input of, if there's a delay within the insurance, if there's a delay from maybe we needed more information in processing that referral. So they're also really important to have in that meeting as well. In these care team meetings, they're they're basically created so that we have a safe environment to voice opinions. As I mentioned, every team member interacts differently with the participants. Also, the conversations are a lot different, so we're able to voice our opinions on what those participants might need, or things that maybe perhaps the participant has mentioned to us, and we can all come together so that we can address those patients' goals. Each IDT team works within their scope of practice, and we work with each other to meet the PACE participant needs. And their needs and outcomes are going to differ by participant. Each of our participants, they have different conditions, they have different goals. One participant might have the goal of lowering their blood sugar. Maybe they've had uncontrolled diabetes for the majority of their life. Another participant might have back pain. So their goal is going to be improving their back pain, their mobility, or their flexibility. So each of our participants, their outcomes, their needs, and their goals are going to differ. How we coordinate care. Does anyone know what care coordination would include? You can put it in the chat. So think again about what care coordination is and how this is basically we communicate the needs of the participants to the right person um, for efficiency within that patient's care. What do you think that care coordination includes? Help patients navigating. That is a really big one. A lot of patients, they don't really know how to navigate the system. Some don't know how to call or who to call for refills, especially if they're using the PACE pharmacy. They would actually call us. Maybe previously their pharmacy was Rite Aid or something. So navigating the system is definitely important. So depending on the needs of the participant, care coordination might vary. So for instance, in primary care, the care coordination or the communication might be about scheduling an appointment. Maybe they're unsure how to schedule an appointment. Maybe we've scheduled an appointment and they are being referred elsewhere, but communication about those appointments. Also transportation. Within PACE, PACE provides transportation for participants in need of transportation. There's still communication and coordination because there might be one of our participants that does typically require transportation. However, on this certain day with this certain appointment, their built-in caregivers going with them, or maybe they have a family member going with them, so then we would need to cancel transportation. Or we might have participants, for instance, who have transportation usually, however, now their son, their daughter, their caregiver, whoever their transportation usually is out of town. So then we're providing temporary transportation and we would need to arrange that for them. Also with primary care is prepping the appointments. So for every team member, it might be a little different. For a primary care physician or provider, they might be reviewing the participant's chart. Maybe for a medical assistant or clinical coordinator, they might be printing their pulse or printing out their demographics, or whatever the provider might be needing during the appointment. For the RN, they might have certain worksheets that they print out so that they can gather the correct information during their appointment with the participant to relay back to the primary care provider. So basically every team member has different things that they prep, but we all prep for that appointment beforehand so that we can ensure our participants have the allotted time with their provider during the appointment. Now with specialty care, the way we coordinate and communicate would be in scheduling. We can't just tell a participant that we're referring them to um, hepatology and we don't give them a phone number or we don't schedule them. For the majority of our patients at PACE, we tend to schedule the appointments, we handle the authorizations, we handle the scheduling. We kind of do all of that for them and then we just connect with them to relay the appointment information. But we do have patients that are self-schedulers. So then we have to provide them with the referral authorization and how to go ahead and schedule their appointment. And then what information we need if we need to arrange transportation for them. Transportation, now if that's a self-scheduling patient, when they call us back and let us know when their appointment is, then we would be able to arrange transportation for them. For the patients that are not self-scheduled, this is something that we do as we're scheduling the appointments. We make sure that we have the transportation aligned with that appointment. Also, it's really important, relevant reports or notes are sent over. If we're sending somebody over to oncology and we haven't sent any scans, any lab results or anything that pertain to that appointment, then when that patient arrives, the doctor's really not going to know why they're seeing them. And if the patient relates to them, the doctor was ruling out this diagnosis, if they're able to relay that information to the provider, that provider might have to start all over again from scratch with getting the appropriate lab work or scans when we've probably already done that, which is why we know to refer them to the oncologist. So it's really important that we ensure that those reports are received by the specialty appointment, maybe when we're scheduling. When we call to schedule the appointment, we can make sure that they have everything. Also, if there's anything else needed, because sometimes participants will go to these specialty appointments and the doctor might have an additional lab test that they wanted to do. Now, if that patient or participant was in one of our day centers, which is where we also have the lab, that's something that we could have easily have gotten before their appointment and sent the results over, rather than going to their appointment, needing the blood work, having to go to the lab, and then follow up again with that provider. So we just want to make sure that they have everything that they need for their appointment. It's also in how we receive the reports. So I know this is something different with PACE that we follow up to make sure if a participant had an appointment with their cardiologist last week and we haven't received the report, yes, some specialists do take longer than others to sign off their notes, but we want to make sure that we get their notes so that we know, A, when the participant needs to follow up again with that provider and we can ensure that they have their follow-up scheduled, but also what happened during that appointment and if that participant is being referred elsewhere or basically what's going on so we know how to continue our care. Follow-up, I know for me personally and for people in my life, whether that's coworkers, family members, a lot of times people can go to a specialist appointment and they're told to follow up in a certain amount of time. Maybe the schedule isn't open, or for whatever reason that follow-up is not made the same day. Oftentimes, either we wait until the last minute to schedule it when we remember, and now there's no appointments available. So say you were supposed to follow up in 3 months. Now it's been 3 months and you call the schedule and they're scheduling 3 months out. Now you have to wait 6 months for your follow-up, right? Or for PACE, we tend to schedule those follow-up appointments for our participants. So if we're not aware of when they need to follow up, these can kind of get slipped through the cracks is how you can say it. And we want to make sure that that doesn't happen. So that's another reason why we call to get the reports from the provider and find out when they need to follow up and ensure that they have the follow-up scheduled. What other services besides primary care and a specialist appointments do you think can be coordinated? Try to think about your own care. What other things you needed besides your primary care appointment and your specialty appointments? I know it's different with older adults and PACE participants. We have a lot that we coordinate, but care management services. Since you mentioned care management services, I'm not sure if all of you are aware if you're external caregivers, but PACE actually has a team that follows up when participants have been in the urgent care or the emergency room or something like that to where another organization or even a participant that wasn't aware of that, they might think, I went to the ER and then they go home and what's next? They don't really know what's next or, they were kind of out of it in the emergency room. So by the time they get home, they don't remember what the provider told them to do after. So this team at PACE, they basically have the job of making sure that we get the reports from the urgent care and ER. We know what's needed next, whether that participant needs to be referred to a different specialist, if they need to have certain tests done, if we need to coordinate getting them into a skilled nursing facility because they're unable to return home. And they also ensure that the care team is scheduling the appropriate follow-up with the primary care provider. So that's one of our teams at PACE as well. And yes, we also coordinate when the participant is not in the house. So there's different scenarios that can be. That could be the participant went on vacation, we need to cancel services. Or if the participant went to like a different family members, maybe they typically live with their daughter, now they're gonna go stay with their son for a week. We have to update the system so that transportation knows where they're picking them up for the appointment, right? Because we don't want them to miss their appointments because they went to the wrong house. Um, So that's something we coordinate. So these are different scenarios we're going to go through, and I want you to think of other things you can coordinate. So maybe we coordinate their physical therapy. Maybe we coordinate occupational therapy. As we mentioned, we coordinate them going to dialysis. So there's a lot of different things that actually get taken care of on the care coordination side. So let's go through some of these scenarios, and then you guys can put your answers in the chat. The first one, Marisol is seen in the emergency room for chest pain. She had a thorough exam and testing, and Marisol was diagnosed with a heart attack. How do you think that care coordination would follow this emergency room visit? Make him an appointment with the cardiologist. Almost 90 to 100% of the time, right? They're going to have to follow a cardiologist now that they've had a heart attack. So first thing we might coordinate is a primary care follow-up, right? So that we can go over what happened in the emergency room and then refer them out to that cardiologist. There might be additional testing that's needed. Um, Adjusting the medication, yes. If we need to change any maybe blood pressure medications, or they're starting a new medication, we need to make sure that we get that in the system so that they can get their medication adjusted or sent out in appropriate time. Follow-up care, just because they had a heart attack, this could have caused other things. Maybe they now need to see physical therapy. They might need to, they definitely need to follow up with their primary care, but there might be other people that they need to follow up with also within PACE. And then either get that follow-up appointment with the cardiologist they saw in the emergency room or get referred out to a cardiologist that they're going to establish care with. Um, they also might need stress tests. There's different testing that they might need. So that's the reason why we definitely want to make sure we initiate the process with the PCP follow-up, because whatever additional testing they might need or that cardiologist is going to require, we want to make sure that we get all that done for the participant as well. We help the primary with the PCP, nurse visits. So with MPACE, they do have to have a visit with their nurse and with their primary care when they get out of the ER. This is just to make sure that we've followed up. We know what medications they're taking. We know what testing they've had or they might need. And again, to make sure that we get the process started with referring them to the cardiologist. Now this scenario 2. So with PACE participants, they have a home visit assessment from the home health aides that they go out to check on the patients and their environment. So during a home visit, it's noted that Sherry's home is cluttered, her refrigerator is not working properly, and she has food insecurities. What would care coordination after this home visit look like? There's two ways of answering this. This might be somebody that lives independently when it comes to the refrigerator, and this also might be someone who's living like in a complex with a management team. So this one as caregivers, let's address the first thing about the home being cluttered. What are things that we can do to coordinate care for the home being cluttered? A caregiver to help organize. It's a difficult task sometimes. We have, 3 or 4 things that we need to do. Maybe we're scheduled with that person for only a couple hours and we have to, help with the shower, maybe a meal, getting them ready for bed or getting ready for the day. But sometimes we can find a little bit of time, maybe each shift, to sit down and organize different areas. It's also a task when working with older adults because they get attached to their items, right? So sometimes there might be clutter because of hoarding, or they might be attached to something that they don't want to let go of, and they have like 5 crock pots. So sometimes we need to encourage them to organize the area or to let go of certain things and let them know, they're not letting go of the person or that memory, just the item because they already have 5 crock pots. But yes, definitely a caregiver that can help organize, or even if they have family members that are present in their care, maybe talking to them to let them know it's hazardous, right? If the house is cluttered and they can't navigate through their home, or we can't navigate their home through their home as caregivers, it becomes a work hazard for us. Now, what about the refrigerator not working? So this is where it's gonna depend, right? Because if the refrigerator's not working and they live independently, PACE might need to address this during the team meeting and, um, either authorize a new refrigerator for that position, that participant, or having them have that refrigerator removed also. If this is somebody that's living in an apartment complex or in a facility where the refrigerator was provided when they moved in, um, that would be different. Then we help navigate that participant getting a new refrigerator from that facility or from that management at the apartment complex because they're ultimately responsible in replacing them. And we want to ensure that they do replace it because if not, then we need to help the participant get a new refrigerator so that we can make sure that they're eating healthy, balanced meals. And if there's food insecurities with the PACE, how would we coordinate care for that? Or what would we communicate with that? Refer to food pantries? So this is another example of the IDT structure and why we have the registered dietitians in the meeting or the social workers, send them food so we can refer them to different programs that provide healthy meals for the participants. We might help enroll them in EBT if they're eligible for that. We might send them, like you mentioned, food. We have emergency food that we might be able to provide. So it's all going to depend on the need of that participant, but that's all coordinated in that IDT meeting as well. Next scenario, and many of you might have had a participant or patient like this, but the participant Henry is being discharged from a skilled nursing facility after a few weeks due to a recent hip fracture from a fall. How would the team communicate Henry's care coordination in this? So he's being discharged from the skilled nursing facility and he's going back home. What do you think gets coordinated? Physical therapy or even occupational therapy, depending. So in the IDT meetings, this is something that we actually plan ahead for. If we have a potential, the nurse visits, yes, definitely. If we have a potential discharge date and we know they're supposed to be in the facility maybe for a couple weeks or it's going to be a month, we start planning ahead because if there's assisted devices that they're going to need in the home, such as grab bars installed, or something like that, or we know they need physical therapy or occupational therapy, we would have them assessed before discharge so that we know exactly what they're going to need and we get that scheduled before they're discharged. Also, maybe they were living independently, but now they're going to go live with their daughter, son, relative, because they're unable to care for themselves at home 100% or navigate through their home 100%. So we have to make sure that we coordinate, their transportation to wherever they're going once they get discharged and make sure, yes, like you mentioned, that they have their caregiver hours in place. They have their follow-up schedule with the primary care provider and with the RN. But basically, these are things that we start coordinating before they're even discharged so that we're prepared upon discharge. And the need for a caregiver can change. Maybe they already had a caregiver before their fall, before the hip fracture, but maybe their caregiver was only there, a couple of times a week, and it was to help with laundry or just for interaction or socialization. But now we might need to address the caregiver hours because maybe we need to extend those caregiver hours. maybe that caregiver doesn't work maybe necessarily in that environment, and we need somebody that can provide more care. So those are all things that we need to address also before they're discharged. Now, in this scenario, Brian is currently established with a hepatologist for hepatitis. His follow-up with the hepatologist is in 3 months. But Brian has a reassessment with this PCP, and one of his liver tests is showing changes. What do you think the best care coordination should be for Brian? Try to facilitate his appointment, so maybe Brian needs to get in with the hepatologist sooner than later, right? Maybe he can't wait for the 3 months. Bring it up. Yeah, so the first thing what we're going to do is probably contact that hepatologist, right? We might call them with the result. We might fax the result to them, and then call them and let them know this needs to be addressed. And then we need to find out, right, his appointment. This is what the change is. Does Brian need to be seen sooner, or can he wait until that 3-month appointment? But we want to ensure that that change is not severe enough to where we let it slide for 3 months, and then there's a complication because we didn't address it with the hepatologist. So we want to make sure that we contact them, we find out if they need to be seen sooner, or what if there's another test that they need done. Maybe when we give them those changes, they might say, okay, can you guys go ahead and draw this, this, and this for the participant? Maybe there's additional testing that they need, then the hepatologist can review that, and we find out whether they need to be seen sooner or much. But definitely there needs to be some kind of care coordination between the primary care office and the specialist office. So in conclusion, this is why we do the presentation. Basically, we want you to understand when healthcare providers come together, not just within PACE, but any healthcare organization. This includes caregivers or anyone that's a part of the participant or patient's care team. And when we come together, we can provide effective care aligned with patient goals because we're communicating the participants' needs. We're making sure that their needs or their concerns get addressed. And we're making sure that the patient basically doesn't have to worry about what's going to happen next, and they're not left to figure that out on their own. It's all, we all have our part in that patient's care, participant's care, and we want to make sure that that we're providing the best care that we can for that participant.